So in sickle cell disease, our patients often have acute pain episodes that are exquisitely painful. They're supposed to be like unmedicated childbirth. And as they age, they often start to have the pain crises come closer and closer together, are on opiates continuously, and start to develop chronic pain. And there's a lot of debate about what this chronic pain is. Is it from sickle cell, or is it from the overuse of opioids? Is it from repeated pain events damaging the nerves? And the thing about chronic pain is it doesn't respond well to opiates. And so it's very difficult to distinguish between an acute episode and a patient's daily pain that maybe is a little worse that day, but leads to mistreatment, giving patients opiates, which might be making the chronic pain worse. So I'm trying to find ways to differentiate between that daily chronic pain that needs other management from an acute pain event. And so I took blood from 150 patients with sickle cell, looked at how their transcriptomes looked when they were in their usual state of health, and then when they were hospitalized with a pain crisis. And I did this both for patients that said that they were pain-free in between their pain episodes, so acute pain only, and those that say they have pain most days or on opiates most days for the last 6 months, which is a chronic pain cohort. And when I looked at the genes that were upregulated or downregulated compared to their usual state of health in the two groups, there's a lot more biological change in the acute pain only group. And we saw those same changes in some key genes when we followed their blood samples longitudinally. So every pain crisis in the acute pain group looked kind of similar among those individuals. And so we are going to seek to validate those biomarkers to see if they are seen in adult patients as well with sickle cell and a pain crisis, and see if they can guide management. IL-1 beta was one that performed well, and FAM20B was another one. So there were 4 that looked promising, and those 2 especially, both based on the significance of the association and what they are expected to do in the body. And so I hope eventually it can be a quick, rapid test that can be performed in an emergency room and really give guidance to providers as to how to best manage that patient. I am recruiting patients, adult patients, in Atlanta. We've already gotten 300 samples from those patients, and we'll do a similar study that we did with these pediatric samples. It's helpful to first do it in pediatric patients because it's a little easier to differentiate between acute and chronic pain in very young patients because they have lower rates of chronic pain, but then it's essential to make sure it still holds in the more challenging population. And there was a lot of interest in the audience to participate in this with me and send me samples from other countries. And so that's very exciting because practices are different. And so that'll help us better see what is driven by opioid use and what is driven by sickle biology.